Spring is just around the corner, and that means so is the new spring semester here in South Korea. The upcoming semester will be a whole lot different for many students who can now enjoy school life under much eased virus rules like no mask wearing. For more, we turn to Professor Choe Young-june from Korea University Anam Hospital here in Seoul. Good morning, Professor.
Good morning.
So, first off, it's been 2 weeks since the vaccination program for infants and young children aged from 6 months to 4 years began here in the country. So far, how is the vaccination rate among the targeted group?
So the vaccination rate is still very low. The data is not readily available to the public at this moment. But as of last week, about 1,000 children have been vaccinated so far, which is out of total population of 1.1 million. So the rate is still very low at 0.1% or still less than 1% at this moment.
Right, that is very low compared to other age groups. Now, then why do you think many parents are hesitant of getting their children vaccinated? I mean, what's the right or even appropriate move in the so-called endemic era?
So there were several surveys that was done here in Korea. We measured that many parents, because of either lack of information, lack of trust with the science or the medicine, they might have a negative perception of the vaccine's effectiveness. They might hear rumors about the vaccines causing something bad to their babies, or they themselves may have experienced the adverse events. And so I guess we should provide the parents with the accurate and reliable information of the vaccine's effectiveness and safety, which is very important to increase the uptake of the COVID vaccine in children.
Right, getting the accurate, correct, and most up-to-date information for those vulnerable groups is quite crucial at the moment. And now students will begin the semester in completely mask-free settings soon, including during their lunchtime. Do you think it's now safe to enjoy classes without masks? What do students need to be careful or cautious of particularly?
I believe, yes, students can enjoy classes without mask safely now. Now we have the Omicron variant, which is less severe in children without any underlying diseases. Also, there are the cost of wearing the mask in many ways, like it can be uncomfortable for the children, particularly for long periods in a warm environment. It covers the nose and mouth that can make the verbal or nonverbal communication difficult, especially for the children. So they might have a wrong inference about the emotions of others who are partially covered their faces. Can be not accurate. So I think above all, with measuring the risk and the cost and the benefit of wearing a mask, I think it is now the time the students can safely enjoy their classes without mask.
Right, and still we do have to remember that mask wearing is now recommended, it's not completely gone, right?
Exactly.
And COVID infections have been on a downward trend here in South Korea, hovering around 10,000 a day recently. But do you think the new school term under much eased virus rules can be a variable, possibly bringing the spike in terms of COVID-19 number of virus?
I think in the setting of the COVID endemic, we probably should not be caring about the total number of the patients. Rather, we probably have to focus on the number of the patients who are very sick or very ill because of COVID, meaning we should not focus on the high-risk patient who can be serious when getting their COVID. So so far, we have had various measures to prevent from COVID, and still vaccine is the only way to protect from the severe COVID. So I think it is now time for us to focus on vaccinating on people who can be serious when getting their COVID.
Right. We do have new case reported, new cases being reported every day, but we do have to keep in mind that we have those severely ill patients at hospitals still.
Right.
All right. Thank you, Professor, for your time this morning.
Thank you.